Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Changing one card into another is a snap, if you know the secret. Let me show you how you can take a single card and in just a fraction of a second make it change to any other card you like. We'll do that one more time. Here's the Ace of Spades, make a couple of magic passes, and now it is the Ace of Hearts. So how did we do that? To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Today's tip of the week, Apico. Yes or no? Just yesterday I got an email asking me where would be the best place to get training on how to do apical surgery. And I'm not sure that that's exactly the question we should be asking. Maybe the question is, should we do apical surgery at all as general practitioners? A couple of weeks ago our friend G.I. Joe did a review of the Journal of Endodontics where he compared the outcome and the success rate between traditional retreatment and apical surgery. And for those of you who saw that article or saw that episode, will remember that it was little Joe that did that review. But I think we should listen now to regular sized Joe and review that information one more time before I answer this question. The next article that we found very interesting was entitled Outcomes of Non-Surgical Retreatment and Endodontic Surgery, a Systematic Review. And what they did was compare the success rate with surgical versus non-surgical endodontics. And they found a very interesting thing. For the first 2 to 4 years, the non-surgical was not as good as the surgical outcome. Surgery got a 77.8 success rate, where non-surgical at the same time period only got 70%. However, this relationship was reversed with non-surgical showing a higher success rate of 83% compared with only 71% for endodontic surgery. Now, after that, they didn't have enough studies to compare it, but it would appear that the much higher success rate with non-surgical retreatment is what we probably should be doing. So what is the definition of success in endodontics? Traditionally, if there is no increase in size of an existing lesion, or if a lesion does not develop, and if the case does not have symptoms for a 4-year period of time, that's generally considered a success. Well, we just heard from the article in Journal of Endodontics that the success rate of endodontic surgery is higher than traditional surgery for the first 4 years. But that's part of our definition of success. So we really aren't tracking those cases and finding out exactly how successful they are. I've seen anything from 35% to 98% success rate. They've all been retro studies for the most part, and so I'm not sure. But here's the real question. Do we even want to do apical surgery in our practice? Apical surgery frequently produces a scar. Many times there's post-op infections involved. There's almost always a period of pain, and patients don't like pain. I don't like hurting my patients. My thoughts are there are so many other things that you can do that are profitable. Why waste your time? Why create stress for your patients in doing apical surgery? There are a lot of offices, a lot of different oral surgeons that you can refer to. My suggestion, don't do it. It's too short. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.